Good afternoon, everybody. Christine Barconi here in the NBC4i Streaming Center. Thank you so much for joining me again. Pivoting away from weather now, we are going to be talking to Dr. Mysheika Roberts, Columbus Public Health Commissioner, joining me right now. I like catching up with her monthly to talk about the status of things and how everything is going as far as now we're getting pretty deep into vaccine distribution as more and more of our senior citizens are starting to get vaccinated. Dr. Roberts, how are things going in general?
Well, I think they're going well. We've got a great operation at the fairgrounds where we've been vaccinating 1A, and then we recently moved to 1B with our adults over 75 is what we've been focused on now this week. And it's going well. People who are coming to the fairgrounds are pleased. We've done as many as 1,000, almost 1,100 vaccines in one day. We just want more vaccines. If we had more vaccines, we could vaccinate more people.
When do you guys anticipate getting more vaccines? And I guess what are the percentages? How are you short? Are you running out? What's going on with that?
Well, we get a limited quantity every week, and we're told that we can vaccinate, either 1A or 1B with that allotment that we get. And we know that there are more people over 75 who want the vaccine than we get vaccine for. So, for example, this past week, I think we got 600 doses of vaccine to vaccinate those 75 and older. But we know there's more than 600 people in our community that want this vaccine. So that's the challenge.
Now, are you guys sharing these doses that are being allotted by the state with hospitals and providers and different things like that as well?
No, each hospital gets their own allotment or allocation of vaccines to also vaccinate that 1B or that 75 and older population.
Okay, so do you think the majority of the elderly in our community, are they coming to you guys for the vaccine, or do you think they're going to their private practice, their hospital, etc.?
I think if they have a provider, which most of them do, they're contacting their providers, but their providers are filling up quickly, as you can imagine. And so when their providers fill up, then they're like, where do I go? And they often come to us. There are other options for them as well. They can go to Kroger and Giant Eagle. They also have vaccine. And then starting next week, some of our CVSs and Walgreens, in addition to Kroger and Giant Eagle, in addition to hospital systems, and in addition to public health, will have the vaccine.
Yeah, I was just looking at the numbers, and it made me, obviously we would like to see it higher, but it made me really happy to see just a few minutes ago, 45% of people in Franklin County, 80 and older, are vaccinated. How's that make you feel to watch those numbers tick up, especially with our most vulnerable in our community becoming protected?
Well, obviously, I'd like to see the numbers higher than that.
Yeah.
We'd want 100% of that population to get vaccinated. So we've got a lot more work to do to inform them about the efficacy and safety of the vaccine, but also to give them information of where they can go to get the vaccine so that we can get 100% of our 80 and olders vaccinated in Franklin County. That's the goal.
What would you like to see as far as working with the state? How is that going? Is there anything that you think could be improved upon right now?
Well, I think, it's going well. I would say, this challenge that we all have, wherever you're located here in Ohio and really across the nation, is we don't get enough information about the vaccines in advance. So we can only schedule a week in advance. We find out on a Wednesday how much vaccine we're getting the following week, and then that vaccine comes in on a Tuesday or Wednesday the next week. So we can't schedule multiple weeks out because we just don't know how much vaccine we're going to get. So that's a complaint you hear people from around the country say, and that's not the state's fault.
Right.
And I think our federal government is trying to work on that plan to fix some of those issues for us.
Okay. So right now we're in phase 1B. People 75 and older can be vaccinated. And today was another big day. People with developmental disabilities could also be vaccinated. Is that correct? Or has it been this past week that they've been doing that?
They were eligible as of Monday.
Okay.
And they are individuals who were born with congenital or medical issues and are under the care of their local board of developmental disabilities. So it's a relatively small population. And Franklin County Public Health, as well as Nationwide Children's Hospital, are working with those patients to get them the vaccine.
That's great. And how has the response been like in that group of people? Are people reaching out and getting the vaccine, or are they still a little bit hesitant about that?
Well, I think, the Board of Developmental Disabilities did a good job of reaching out to those patients to let them know they were eligible. I actually don't have updated information to know how that process is going.
We did talk to the superintendent today, very complimentary working with you guys, just to
Great.
let you know that we have a story coming up on that today. So this is kind of a I don't want to use the word big because it perhaps should not be. We all should still be staying at home. But the curfew is pushed back by 1 hour in the state. But in here in Columbus, Franklin County, we're still under that stay home advisory. What's your advice to people? Even obviously, you want people to stay home if we're under that advisory, but how does it make you feel knowing that it is pushed back? What was your reaction when you heard it would be pushed back?
Well, I do want people to stay at home. That is, the stay-at-home advisory is in place till February 6th. Our numbers here in Columbus and in Franklin County are still very high. I think that what the governor did by pushing back the curfew an hour was made sense in terms of following the hospital data. But I just want to remind people that if you do choose to be out and about, you still need to take the necessary precautions. This virus is still circulating in our community, and people should be very concerned.
Absolutely. Moving on to teachers in our schools, are teachers going to be getting vaccinated soon? I saw you kind of smile at that. I know a lot of people are very excited about that. What are you guys doing? Are you working with CCS to make sure the teachers get vaccinated? How's that process going?
Yeah, we're working with CCS. We're also working with Worthington School District and all of our private, parochial, and charter schools that are in our district to get them vaccinated starting next week. That link is going to be sent out, if it hasn't already, today to our teachers in those districts.
Oh, I bet
So
that's
they can
great.
register
Yeah.
and get vaccinated. And starting next Wednesday, we will have vaccine for our teachers.
That's
And I
fantastic.
just I just should add, it's not just teachers, it's all
Yeah.
staff who will be in contact with students in K through 12 buildings.
How does it make you feel knowing that these kids, because you're the public health commissioner, you're not just focused on COVID. Before COVID came about, it was a overall health and wellness, and that's still your job. How important is it to get these kids back in the classroom, not only for their mental but their physical health as well?
I think it's extremely important. Our kids belong in the classroom, and we've seen data and papers after paper that have said our kids are safe in the classroom. Classrooms are not super spreader environments, and so if everyone is wearing their mask, practicing the social distancing, washing their hands, they will be safe in the classroom. So I look at it as this vaccine is just another layer of protection for both the students and the teachers. And I'm excited to see the kids in Columbus City Schools back into the classroom. And I'm excited of all the things that Columbus City Schools has done to make a safe environment for not only the students, but also their staff.
So, in phase 1B, I believe it's the 8th, 65 and up will be eligible for the vaccine. Are we taking a pause in letting 1A and 1B get vaccinated? What's that process going to look like? How long are we holding at phase 1A and 1B until the next round of people can start getting vaccinated?
So we're not taking a pause.
Oh, okay.
We will next week. We will February 1. We will add 70 and older to that list across the state. Columbus Public Health is somewhat of a unique health department because we will be doing 70 and up, as well as taking on the responsibility of vaccinating our the staff in K through 12 buildings. So next week's going to be a very busy week for Columbus Public Health. We're expecting over 6,000 doses of vaccine to come to us, and we will be distributing it between those over 70, Columbus City Schools, Worthington City Schools, as well as our private parochial and charter schools.
That's fantastic. I can't wait for that as more and more people get vaccinated. That is really just wonderful. So going back to the curfew that we have here in Ohio, have you and Mayor Ginther discussed at all if the curfew does get lifted? I believe come at 2 o'clock today, we'll be on day 4 or 5 I'm trying to remember the numbers in my head, working towards that midnight curfew. Is the city going to continue to follow the state's curfew, or have you guys considered making the its own curfew for 11 or midnight if the curfew were to be lifted here in the near future?
I have not had that discussion with Mayor Ginther to do a local curfew. That has not been discussed.
Okay. All right. Trying to look through our viewer questions right now. Thank you guys for watching. We really appreciate it. Looking more, oh, I do want to ask you about this. It's been a hot topic this week. I don't know if you've been asked already by one of our reporters. I know we're in frequent contact with you, but double masking is something that a lot of people are talking about. What are your thoughts on double masking and or upgrading from perhaps our cloth mask to, yeah, I've got two, I've already done it, upgrading to a KN95 or an N95 equivalent or a surgical mask? What are your thoughts on that?
So what my personal and professional thoughts are is, first of all, we always follow CDC and ODH guidance. CDC has not come out with guidance that says you should wear two masks. I think what's most important is people should wear their mask appropriately, which means they should cover their mouth and their nose at all times. Having your mask fall below your nose is not an appropriate way of wearing your mask. And like many experts have said, we are anticipating these new variants that have been identified to start circulating more in our community. They're probably already here. From what we know, they are more virulent, so they're stronger, they're more contagious. And so whatever you can do to protect yourself from those viruses. So first, you could avoid being out and about. So again, following the stay-at-home advisory. Then make sure you wear your mask properly. Keep your social distancing from other people. Wash your hands and avoid large gatherings. So I think if we do all of those things, until there's some clear guidance from the CDC that says we should do otherwise, I think one mask is appropriate at this point in time.
Okay, so I want to ask you about the Johnson & Johnson vaccine. Information came out about that today. It's not as effective as the Moderna or the Pfizer vaccines. What are your thoughts on that? What do you know about that, and what can you tell us? Is it going to be distributed? What's going on with that?
So I probably know just about what everyone else knows. I have read the initial media reports. I haven't been able to read much of the scientific data at this point. But I think, first of all, it's great to have another option. And so we have two on the market right now, two vaccines on the market. To have a third option is great. It gives us some choices, but it also gives us a larger bandwidth. We'll get more vaccine to be able to vaccinate our community. So that's great. And yes, the effectiveness is not as high as the Moderna and the Pfizer vaccine, but as many people have reminded us, the flu vaccine, which is a vaccine that many of us get every year, has a 40 to 60% effective rate, and we're still getting it every year. So from what I've read, the Johnson & Johnson vaccine has somewhere in the ballpark of a 70% effectiveness rate. So that's much better than the annual flu vaccine that we get. And remember, it's just one shot. And so that will be easier for us to help get the vaccine out in the community, as well as everyone, just with one dose versus two.
Certainly. When that does hit the market and it's coming up and more people are getting vaccinated, would perhaps people, whenever it opens up to like my age group, maybe like, 40 and under, would we perhaps get that vaccine over the Moderna and save that for our frontline workers and elderly population? Would that be perhaps a tool?
I think anything's a possibility.
Okay.
I mean, we're really going to have to first wait for that emergency use authorization to be given by the FDA, and then to see what kind of recommendations CDC puts out that goes along with that new product. But I think some of the ideas you mentioned are a possibility, but we'll just have to wait and see what the experts decide.
All right. Dr. Roberts, I don't want to take too much of your time. I know it's a very busy day for you. Anything else that I didn't ask that our viewers might want to know that you want to let them know?
Well, I just want to remind them that if they have questions about the vaccine, they can go look at our website, which is columbus.gov/coronavirus. They can also go to Ohio Department of Health website, which is vaccine.coronavirus.ohio.gov. Lots of information there for everyone. So I encourage them to get informed, get educated about these vaccines.
Absolutely. Dr. Roberts, thank you as always for your time and answering our questions. We really appreciate it. Guys, all those links that she had mentioned are up on our website, NBC4i.com, if you want to check those out. And we will, of course, clip this full interview and put it up online here shortly as well if you would like to rewatch it. We'll see you later. Bye.